So here we are going to learn about the tumors of the smooth muscles, and this also has two types as benign and malignant. The benign form is leiomyoma, and the malignant form is leiomyosarcoma. So what is leiomyoma? Leiomyoma is the benign tumor of smooth muscles origin, and it is most common in uterus. So this leiomyoma in the uterus called as the fibroid. So what are the common sites where you can find leiomyoma? Uterus is the most common site. So when focusing on this picture, you can see the uterine fibroids or the leiomyomas, and there is so here there is a cervical fibroid, and here there is a submucosal fibroid. Here there is a intramural fibroid. Here there is an intracavitary fibroid, and here subserosal and pedunculate fibroid. So these fibroids are leiomyomas, and uterus is the place where leiomyomas can be most commonly seen. Also, they can be seen in the skin or gastrointestinal tract, or also in blood vessel walls. If it is on the blood vessel wall, we call it as angioleiomyoma. Let us discuss something about etiology and pathogenesis. So, this is hormone dependent, especially it is estrogen sensitive. The and the clonal tumor of smooth muscle cell, it is a clonal tumor of smooth muscle cells, and the genetic changes are in the MED12 mutations. It is the mutation commonly seen. When talking about the gross features, as you can see, they are well circumscribed, and when touching them, they are firm, and they are round nodules. So here you can see they are well circumscribed, and they are firm, and they have round nodules. And when you see this cut surface, you can see that gray-white cut surface with gray-white cut surface with rolled appearance. Gray-white cut surface with rolled appearance can be seen. Also, as we discussed earlier, so there can be sorry, they can be intramural, subserosal, or submucosal. So this is the cut surface, which is gray white, which has a gray white appearance, and this is also leiomyoma in the uterus, and you can see that is well circumscribed, and it nodular, and when you touch it, you will feel firm. So what are the microscopic features? So the most important thing in the microscopic feature is these nucleus. Look at these nucleus, they are cigar shaped. We call it as cigar shaped nucleuses. Cigar shaped nuclei is there. Also, the cells are spindle in shape, and they have eosinophilic cytoplasm. Look here, the cells are spindle in shape. Can see that spindle shape of the cells, and inside the cells you have the sugar shaped nuclei, and they are eosinophilic cytoplasm. And mitosis, rare or minimal mitosis, and non-necrosis, and interlacing bundles or the fascicles of the smooth muscle cells can be seen. So this is also another picture. It is actually not clear than this. You can clearly see the cigar-shaped nucleus in this picture. So degenerative uh, so Let's discuss about the degenerative changes. It is common in large tumors. So there can be an hyaline degeneration. It is the most common degeneration. Also cystic changes, calcification, and red degeneration can happen during the pregnancy. When considering about the clinical features, often they are asymptomatic and it causes menorrhagia or heavy menstrual bleeding, and uh, they can have a pelvic pain or pressure. And if the tumor is submucosal type, then they will have the infertility. What are the complications? As you know, as we discussed here, it causes menorrhagia or heavy menstrual bleeding, so the patient can get the anemia. Also, it can cause torsion, in subserosal and pedunculated fibroids, and it has a rare transformation to a malignancy called leiomyosarcoma, but usually leiomyosarcomas arise from its own de novo synthesis, but rarely this can cause a malignant transformation. We will discuss this later. And the next malignant type of smooth muscle tumor is the leiomyosarcoma. The definition is leiomyosarcoma is the malignant tumor of smooth muscle origin. This also most commonly occur in the uterus. Leiomyomas also occur most commonly in the uterus, but also reported in retroperitoneum and soft tissues and blood vessels. In the retroperitoneum, we discussed in the previous video that adipo adipocytic tumors, uh, liposarcoma or liposarcoma can be seen in retroperitoneum also. So, leiomyosarcoma also seen in retroperitoneum. Etiology and pathogenesis of leiomyosarcoma is it usually arises de novo, not from leiomyoma, but rarely it can occur from rheomyoma. So it has complex genetic alterations in examples in the P53 or RB pathway abnormalities, and it does not strongly depend on estrogen, unlike in leiomyoma. We talked in the previous slide that here in the previous slide that uh, we talked that we talked in that leiomyomas depend on are estrogen sensitive, but leiomyosarcomas are not estrogen sensitive. It does not depend on estrogen. So what are the gross features? So you can see a leiomyosarcoma. They are poorly circumscribed. You can see this, and they are infiltrative masses, and they are soft and fleshy. The fleshiness of these leiomyosarcomas can be described as fish flesh appearance. And when we talk about the cut surfaces, there may be small hemorrhages, and here actually you can't see those things. Hemorrhages can be seen, small hemorrhages, but there can be necrosis. Here you can see there can be hemorrhages and necrosis also in a cut surface. The most important thing is they are poorly circumscribed and they are infiltrating masses. As we discussed in the earliest part, as this is a malignant tumor, it should be infiltrative and poor circumscription. When talking about the microscopic appearance of leiomyosarcoma, there is a diagnostic triad. They are the pleomorphism. You can see the pleomorphism of pleomorphism or the marked atypia of the cells, and high mitotic activity is also there, and tumor necrosis is also there. These are the diagnostic triad. And when talking about the tumor cells, they are spindle shaped smooth muscle cells, because these are smooth muscle cells, and you can see It contains fascicles and they are hyperchromatic. The cells are hyperchromatic, and their nucleus is basare, large tumor cell, basare nuclei, and there are also abnormal mitotic figures like these things. And you can see some necrosis areas, and also a apoptic bodies, apoptic bodies here. Here also, this is a nice picture that you can see those things. So the clinical features of leiomyosarcoma are, it occurs in the clinical features are you can see post-menopausal bleeding in uterine cases, and also rapidly enlarging uterine mass, and pelvic pain and mass effect can be there. So how does it spread? As it is a malignancy, it has metastasis. Hematogenous metastasis is there. Metastasis is common for lungs, liver, and bone.